Good afternoon, everybody. It's just after 12, so we'll get started shortly, and probably other people, as they finish up their clinical commitments for the morning, will join us as well. So welcome. I'm Shannon Burke. I'm the manager of the Central East Regional Cancer Program, Cancer Screening Prevention, and the Indigenous Cancer Program. We're thankful to have you all here with us today, and especially thankful to Dr. Iqbal for joining us. I'll introduce him in just a moment. Want to introduce Dr. Avnish Mehta, our regional primary care lead, who's with us as well, and Caitlin Loudon, who is our engagement lead for primary care for the Central East region. So a name that we want you to become familiar with is Caitlin. So Dr. Iqbal is a radiation oncologist here at the Durham Regional Cancer Center. He grew up out west and did some training at the Mayo Clinic. He completed his fellowship at the Mayo Clinic. He's been a radiation oncologist at the Durham Regional Cancer Center since then, and he treats primarily breast, lung, GI cancers. And most recently, during the pandemic, he became very interested in cancer prevention, and specifically around alcohol and understanding it as an under-recognized carcinogen. He was even featured on The National in a TV segment, which I'm sure he's really thrilled that I drew attention to. But he did a great job on the National presenting on this topic as well. So we're very thankful to Dr. Iqbal for being here today, and I will turn it over to him to present on this topic. Thanks so much.
Okay, thank you. Let me just get my slides going. And you should be able to see that now. Okay, so thanks, Shannon. Thanks, everybody, for taking the time today. It's a relevant topic currently because the new guidelines are coming out for low-risk alcohol intake, and those are set to be coming out basically in the new year. So this is kind of the preliminary kind of backgrounder to that. Because there's been a lot of work that went into that, not by me, but by smarter people than me. I do also apologize. It's a weird kind of environment to do a talk, so I'm just kind of staring at my screen in the office. It's strange, so I can't see like chat messaging or anything. So if somebody can cue me, if like somebody's trying to do something, just let me know because I can't see anything. So yeah, Shannon kind of mentioned it already. Like I'm from Calgary. I grew up in Calgary and I went to med school in Edmonton. That wasn't cold enough, so I went to Winnipeg for my residency, which was very cold. From there, it's just a hop across the border to the Mayo Clinic, so that's where I ended up. And then from there to here. So I don't really have any kind of conflict of interest statements for this talk. There's no financial conflicts or research conflicts or whatever. But I think the kind of bias I guess you need to know about is that I don't drink and I don't smoke. So this is coming from a perspective of somebody who doesn't drink, which is unlike the majority of Canadians. So the stats generally tell us that it's about 80% of Canadians drink and about 20% of Canadians don't. So kind of factor that in, you know, when you're hearing me talk. But I guess the other part of it I'll say is like, I don't care if people drink, like pretty much all my friends drink. You know, when I think about kind of drug access or like legalization of marijuana, like, I don't care, like, that's fine by me. You know, I'm not like a hardliner that I'm going to come down on people. Like it's fine. People can do whatever they want. The angle on this is more, do people know what they're doing? Like, is there an informed amount of information about what they're doing? And that's where I think alcohol has managed to kind of just slide by for whatever reason, you know, in terms of kind of avoiding negative publicity, I guess I'll put it that way. So it's not like this is new, like this really isn't new information to people. The Canadian Medical Association nationally, like actually passed a policy about this. Geez, I was in junior high. So 1991, that alcohol probably should have warning labels on it because it is quite toxic. So, you know, this is 30 odd years ago that this actually had a national push. And even prior to that, like, there's a lot that goes back even further. I'll get to some of the history in a little bit. So I'll try and pace myself properly so we have some question time at the end. But this was part of the kind of lead in. So we'll talk a little bit about kind of consumer awareness or lack thereof, kind of the evidence in terms of alcohol linking to cancer, some policy stuff, more so about tobacco really. And then for primary care, I think it's going to come down to really those low risk guidelines. So I'll focus in on that. And that should get us pretty close to about 1250, I'm hoping. So I'm going to start kind of with the outsider perspective idea, because I know for a fact that most physicians drink as well. So it's not just kind of the general population. Physicians are typically big drinkers when we're polled as well. So I'm the outsider looking in. So here's a kind of outsider looking in example. You'll figure it out very quickly. But anyways, I mean, if there's a product and people use this product, most people use this product without a lot of problems. People are very protective of this particular product. The country actually has, well, this country has legislation about this product. There's a very, very powerful lobby that applies pressure to the government. And honestly, people don't particularly care about this product until really, really bad stuff happens. But otherwise, I mean, in that country, almost 50,000 people get killed by guns, right? So, guns in the States, this is not news to anybody. It's crazy down there. The entire world thinks it's crazy what's going on down there. But if you ask kind of the gun side of the American lobby, it's entirely normal for people to have guns. Everybody should have access to guns. The solution to gun violence is to have more guns. Like, their logic is insane. But when doctors actually try and address it as like a public health issue, you guys probably remember this from a few years ago, the reply was, stay in your lane. This is not a medical problem. Basically, just go away. So, gun culture is bizarre. I can't claim to understand it, but it is a very well-defined, well-studied entity in America, and it's nuts. Like, to me, it's just totally nuts. So kind of apply the parallel, and now let's flip it over to alcohol in Canada. Pretty much all those same things apply, right? Most people use alcohol without a big problem. There's bars, there's places you can go specifically for alcohol. They've got the LCBO. The legislation in this country is specifically designed to promote alcohol. So, when that gets challenged, there is a very powerful lobby that spends a lot of money to make sure that doesn't happen. And really, most people don't care. Actually, most people are quite happy with their, consumption habits. And for most people, it's not even a big deal, really. It's just kind of a drink or two or whatever. But yeah, almost 20,000 people a year in Canada get killed by alcohol, like just routine deaths as part of the business. I don't know how you want to phrase that. So it's a substantial killer. Globally, it's about 5% of the world gets killed by alcohol every year, but it's just par for the course, apparently. So kind of the thing I want you to take away is not just kind of evidence. There's a little bit of evidence I'll go into, but it's really just that idea that people believe what they're told to believe, right? So if you spend enough money, you can make people believe almost anything you want them to believe. Like I'll use American politics as an example. You've got CNN on one side, you got Fox News on the other side. People who listen to CNN believe this, people who listen to Fox News believe this. Probably the truth is somewhere in the middle. I actually don't know. I don't pay that much attention to American politics, but you can make people believe whatever you want if you spend enough money and if you generate a culture that reinforces whatever it is they want to believe. So if you want people to believe that alcohol is good for them and alcohol is a normal part of society, that, hey, you got to have a drink on Friday night or Saturday night or every night, alcohol will solve your problems. You can make people believe that very easily, actually. So that has been what we've noticed over the pandemic, particularly, is that everybody got stressed out by the pandemic. Doctors, regular people, everybody was just losing it, with COVID, myself included. I was kind of losing my mind a little bit a couple years ago. But lo and behold, if you spend some money, you can solve people's problems with a drink, because everybody knows this too. Alcohol is a really good anxiolytic, right? It's probably one of the best ones out there. So, you've had a stressful day. Oh, COVID's a problem. You're socially isolated. Whatever the issue is. Oh, my kid's having a tantrum. I better put some wine into the sippy cup and drink that as my mom juice. Like all of this got played up over the last few years with very targeted advertising from the industry to just push alcohol consumption. And the government was happy to play along with it, actually, is a really kind of side note to this talk. But yeah, alcohol access went up. Everything was just promoting alcohol. So we know consumption has gone up in these last few years. So same thing, though. People don't care generally unless there's like a disaster. So one piece of legislation that did change a few years ago, this is about 4 or 5 years ago now, is the picture on the left about the teenager in Quebec. So she was drinking kind of those sugary alcoholic kind of, I don't know, spritzer type of things. And she ended up dying essentially of acute alcohol toxicity because she was not aware, nobody was really aware at the time of just how much alcohol was in those drinks. So she ended up having an insane amount of alcohol in her system and just basically got killed by it. So that led to legislation where if it's a sugary drink that has alcohol in it, it has to have a label. But no other alcohol has to be labeled in any particular way. The alcohol requirements for labeling are negligible, I'll say. So, some other examples, just things that I pulled out of the news when I was making this talk was probably about a month or so ago, 2 months ago now. I think the audience here is largely Durham, so you guys would all know this. There was that police officer who got shot in Toronto when that guy was like robbing an automobile repair store, and then he found a police officer and killed him. It was horrible. So that was a horrible thing. It had nothing to do with alcohol as far as I can tell. But about 2 days later, this police officer got killed a few kilometers away from my house by an impaired driver. It barely made the news for whatever reason, just going to say. But yeah, he got killed by an impaired driver. And it sucks. Like, it was just kind of swept under the rug. A few years back, even more dramatic than that, you guys would all remember the Neville Lake family. Basically, the entire family got wiped out by a drunk driver, right? It was just like vomit-inducing bad what happened there. So when bad stuff happens, oh my God, we got to pay attention to alcohol. But otherwise, pancreatitis, whatever. You drink, you got pancreatitis. Liver failure, whatever. You drink, you got liver failure. Oh, domestic violence. Oh, somebody probably deserved it. Oh, beating on the kid, or drunk driver, fight at the bar. Oh, whatever. That's just normal stuff, right? So, for whatever reason, alcohol just gets a pass for all the stuff that it does. And it's not normal. Like, it's just not normal to be on a plane and have some drunk lunatic start punching a flight attendant because he wants another drink. It's not normal. So that's kind of my tirade. I'll steer away from my tirade there. But anyway, so here's actually the numbers. So alcohol actually costs Canada more than any other substance, right? It costs more than tobacco. It far costs more to the Canadian economy than it actually generates in terms of revenue to the government or anything. So, sometimes you'll hear people say, oh, there's a sin tax. I pay my taxes on my alcohol, therefore I can drink because, the taxes are paying for whatever I have to pay in terms of healthcare later. Not really, right? Because actually the detriment to society is far worse than the taxes you paid. So, you can't claim that it's a financially beneficial thing to be drinking either. Like, I mean, just societally, it's not. You lose money on this product. So deaths as well. I mean, this is kind of the point of the talk. It's pretty consistent, slightly above global average. Global average, like I said, was 5% of the world gets killed by alcohol. Canada as a group drinks more than the rest of the world on average by about 50%. So our deaths are higher than global average by a little bit as well. Alcohol doesn't kill as many people as tobacco. Like, I mean, we know tobacco is far more damaging. Like, smoking is really, really bad for people. That's not news. But I mean, alcohol, once again, it just kind of gets a pass. Because if you listen to the news, you know, how many times have you heard about the opioid crisis? And when you actually look at the numbers, granted, these numbers are a few years old, so the opioid crisis has gotten worse over time, but alcohol has also gone up over time as well. Alcohol kills far more people than the opioid crisis, but nobody really talks about it. So there you go. But anyway, so evidence is starting to mount, and evidence has been mounting for many, many years, but I'd say it's kind of exponentially mounting more recently. Because I mean, the oldest published paper on alcohol causing cancer was from 1911, I think it was. It was over 100 years ago. It was esophageal cancer being linked to heavy alcohol consumption. So, you know, there's abundant evidence out there that alcohol causes different kinds of cancers. So the big ones, it's on a later slide. So breast cancer, colorectal, head and neck cancers, esophageal cancers, pretty much anything that alcohol kind of works its way through as it's going through your system. But, you know, globally, once again, alcohol causes a substantial number of deaths, particularly cancer. You know, if you look at the countries and kind of the state of the world, the places that have the least amount of alcohol-related deaths, not surprisingly, have the least amount of alcohol consumption. So one of the things, we'll talk about this a little bit later too, is that people say, oh, well, isn't there some evidence out there that a little bit of alcohol is good for me? So when they did this particular analysis, this was a Lancet kind of global study, very big study, even factoring in kind of minor protective effects, basically once you got above like negligible consumption, the risk of morbidity and mortality starts to go up and up and up. So, I mean, if you look at kind of the x-axis on this, I mean, if you're having 15 standard drinks a day, you know, on the far right of this graph, yeah, that's some heavy duty drinking. But even at the low levels on the curve, I mean, risk starts to go up, right? So these graphics were from that same kind of Lancet study. So this is kind of the cancers that are caused. It's a little bit different globally than it is for Canada. So, you know, there's a little bit more in terms of head and neck cancers when you look kind of globally. But Canada's on the right side. And I put a couple numbers, just straight division. This isn't like, I'm not going to claim completely accurate numbers, but if you took 7,000 cases of cancer from alcohol per year in 2020, which was the estimate, and just divide it by 24% for breast, you get about 1,700. And then colon and rectal, I kind of group those together as colorectal cancer. So that's, you know, 2,500, you know, give or take a little bit. So those are kind of a bulk of cancers, you know, when we look at kind of common cancers in Canada. And the important part of that about that is, even though the risk goes up with consumption, like there's no doubt that the more you drink, the more cancer you get, even with low level consumption, there's a risk. So that was part of the thing about updating the guidelines for low risk drinking, which is at the end of the talk, was that half the people who were getting killed by alcohol in Canada were drinking within the low risk guidelines. So it's clearly not low risk if half the people are dying by following those guidelines. It wasn't just cancer, right? I mean, there's other stuff too, but you know, that led to this revision in terms of kind of the new low risk guidelines. So I think most people know about this, but I mean, I'm standing here in the Cancer Center, so I have to talk a little bit more about cancer. But before I get to that, I mean, there's other things too. I mean, everybody who's in practice has run across pancreatitis, I mean, chronic pancreatitis, like all the kind of many different things, liver disease, atrial fibrillation. I mean, like there's about, I think, 60 or 70 kind of known common medical things that alcohol can cause. There's an interesting study, just as a little side note. It was from Ottawa, where 1% of emergency visits were directly attributable to alcohol. So, I mean, it doesn't sound like a huge number, but I mean, as a single product causing 1% of the visits, it's not insubstantial. Anyways, so yeah, so colorectal cancer, it's the third most common cancer. It's reasonably common in terms of kind of the number of cases. So almost 27,000 Canadians would get colorectal cancer. The majority of them are curable, right? So, I mean, this is why we have screening and fit tests and colonoscopies and kind of all the money that gets thrown into that. But when you actually look at the risk factors for it, I mean, some of it you can't control, right? You can't control aging. But alcohol is a decent chunk of that, right? It's almost 10%. And there was a UK kind of published, it was a UK cancer research poster where they had it as about 1 in 10 people who got colon cancer, they could attribute it to their alcohol intake as well. So I mean, you guys all know this, right? Like, it's not like you can say alcohol was the thing that caused the cancer, because it's not just one thing, right? Like, rarely could we ever say it was just the one thing that did it. I mean, honestly, probably I'm the guy who could say that, because if I gave somebody radiation and they got cancer, it's probably the radiation that gave them cancer. Like that circumstance is one of the few where you could say, I know what gave you cancer. But I mean, when you kind of add up the risk factors, you know, a 1 in 10 kind of risk from alcohol, it's not insubstantial when you start to add it onto some of these other things that people do or don't do. Breast cancer, of course, is one of the more common cancers out there. So, 27,000 women roughly per year. And then the numbers are somewhere between 5 to 10% of breast cancers, depending which study you look at, are related to alcohol intake. So I'll come to the mechanisms in a second. But, by the numbers, breast cancer is caused more by alcohol than by like BRCA mutations or things like that. Because even though, there's certainly a population that has genetic predispositions for cancer, that is a small population. Whereas the number of consumers of alcohol is huge. So even a 5 to 10% out of that number still outstrips the genetic component, right? So, once again, it's not the only thing that causes cancer. I'm not going to claim that, if people drink less, there's going to be less cancer, because I mean, there probably would be, but it's not going to happen instantly, right? It's more about kind of the time effect and kind of the lag in terms of how the mutations have happened in their body. But, the more you drink, the more mutations you get, the more cancer you get. Like, it's actually biologically very plausible and shown reproducibly. So for breast cancer particularly, it's important to note that, if you have younger people coming to your clinic and they're, I don't know, 17 or 18 or 19, maybe starting off in university, and they're going to head to Frosh Week or whatever it is, the amount of drinking in your early years, meaning like biologically formative years, does much more damage than drinking that you're doing later, right? It's the same as smoking, right? Because if you've done, I don't know, smoking or drinking or any kind of, kind of mutagenic toxin in your system, that damage stays with you and kind of amplifies over time, right? So if you're 20 years old and you have too much to drink, okay, you're going to get hungover, but your body can probably deal with that in the short term. I'll come back to that in a second too. But the problem is that the mutations would then stay with you for longer. And there was some evidence that said that when young women in particular are drinking too much, their breast tissue is developing at that point in their life. And that's when mutations can turn kind of further down the road into a bigger problem, because the mutations happening at age 18 they can catch up with you when you're 30 or 40 instead of being 70 or 80, right? So, it's same as most things that we know out there that cause cancer. It's not a one-time effect. It's kind of repeated exposures and then a time lag. And, the younger you start drinking, the more you start drinking, the more this stuff catches up with you. And, we're seeing it here in the Cancer Center. It's been published kind of around the country as well. Cancer patients are getting younger, like for whatever reason, not just alcohol. I'm sure it's not just alcohol, but people are getting cancer younger for a multitude of reasons. And, maybe, I can't prove it, but maybe it's because people are drinking more. So this is one of the ones that I use for my patients. So I don't know if you guys want to kind of make note of this particular website. It's actually it's kind of a layperson facing website. It's called Drink Less for Your Breasts. So it's easy to remember. But it's a group out of California. It's a research group out of California. It's done very, I don't know, casual, I guess I would say is kind of the phrase, but it has like a risk calculator. It has some infographics that people can kind of work through. So, when I have my conversation with my breast patients about, how much do you drink? And they're like, oh, I have, 7 drinks a week and, a little bit more on the weekend. I'll say, well, you might want to just take a look at this and kind of see what you're doing, because this may impact how you choose to spend your weekend. So it's a useful website, Drink Less for Your Breasts. I think it's a .org. But if you Google it, it'll pop right up. Okay, so carcinogenesis is very well established. There's multiple mechanisms for how alcohol causes cancer. This is just kind of top 3, just because I chose 3. So the biggest one in terms of kind of systemic effect for most people is acetaldehyde. So when we actually drink alcohol, your body can deal with it very, very quickly, actually. So the breakdown process leads to essentially sugars, so acetate, which is at the bottom. So your body can use it, for energy or to make a beer belly or whatever. But in between ethanol and acetate, there is acetaldehyde. And acetaldehyde chemically is not very far off from formaldehyde, which I'm sure is really bad for people. So acetaldehyde by itself is a mutagen. It does cause DNA damage, and DNA damages mutations, and then mutations lead to cancer. I'll skip to the bottom there with folate. So folate vitamin, right? There can be folate deficiencies, which are frequently seen with people who drink too much, but our bodies use that vitamin for DNA management and DNA repair. So it's kind of a double-edged thing that you've got acetaldehyde, which is causing DNA mutation, and then you have insufficient folate to help your repair. So kind of together, it's on both sides of it, you're getting DNA damage. In the middle is estrogen, which obviously doesn't apply that much to guys, but it applies to women for breast cancer. That the more you drink, the more estrogen you get. And there's a couple reasons for that, but it's pretty well established from a population level that drinkers have more estrogen, and then more estrogen leads to more breast cancer. So that's kind of its own pathway. Okay, so I'm going to skip it a little bit over to tobacco, just to move it along. So this shouldn't really be news to anybody. Like, I think most people know about the history of tobacco reasonably well. But I mean, within the Americas, for First Nations populations, I mean, they've used tobacco for kind of medicinal and spiritual purposes for many, many thousands of years. But it became commercial, I guess I would say, within the last several hundred years. But even, like 1700s, there was early evidence of like lip cancers being linked to smoking. So 1881 was the first commercial cigarette machine. So obviously kind of production went up around then. By the early 1900s, like everybody practically was smoking. So I mean, it was just, smoking was everywhere. We would probably be smoking while we're having this meeting, and I would be smoking while I'm doing rounds, and the surgeons would be smoking while they're doing their operations, like everybody would be smoking. So it was just kind of nuts back then. But of course, over time, people started to realize, oh, this is really quite bad for people. So by the 1967, the Surgeon General in the U.S. put an official warning that commercial cigarettes and tobacco use can cause cancer, and shortly after that, labeling started. And Canada actually globally is considered a world leader when it comes to tobacco labeling, because we're one of the first that has kind of graphic visual warning labels. And just recently, they've actually kind of moved towards bringing in individual cigarette labels, because if the package didn't warn you, then apparently the cigarette will. But anyways, they're still trying. So tobacco is still very on the radar because it's still pretty common. I think it's one of the bigger killers in terms of our population. But we are starting to see that from about the 70s kind of onwards, tobacco consumption started to fade out. And even just very, very recently, we're starting to see lung cancer numbers are starting to drop. So, you have a carcinogen, people learn about the carcinogen, they start to use less of that carcinogen, and then less cancer happens. But it takes decades and decades for this to happen. So the government actually has its own kind of division within Health Canada. It's the Tobacco Control Directorate. I won't belabor this too much, but there's lots of stuff that they do, right? So labeling, you can't have advertising for tobacco products on, like at a sporting event or something anymore. There's restrictions on where you can sell tobacco. This also applies to vaping as well. So there's lots of things about taxes and discouraging people from smoking, and I don't think this is news to anybody. Even like every smoker out there will admit that they know it's bad for them too. Whereas alcohol, by contrast, it's actually a pretty similar history, probably going back even further. So my research source just for that 10,000 number was National Geographic. So take that what you want. But National Geographic had it that humans have been using alcohol since about 10,000 BC. But over time, basically we got better at making stuff. So by about 800, actually they managed to distill pure alcohol. By about 700 years after that, people started to make different types of alcohol. So production really started ramping up. What is that, about 500 years ago now? But in 1988, the World Health Organization classified alcohol as a carcinogen officially. So it's a group 1 carcinogen, same as tobacco, same as asbestos, same as radiation. So it's not news, like this isn't a new thing. So soon after that, the US passed legislation to label for drinking and driving, and for like don't drink when you're pregnant because it'll damage the fetus. Canada doesn't actually have those laws, by the way, but because we import a lot of stuff from the States, like you'll still see some of those labels. But then in 2016, the Surgeon General put the official warning in the States that alcohol is a carcinogen. And now kind of there's a push basically ever since then in America and then up in Canada to kind of get the news out there that, alcohol causes cancer. So that leads us to the updated low-risk drinking guidelines, which I'll get to. Sorry, this is very similar to the tobacco page, but there's sales restrictions unless you can now get it by Uber. Pricing, like minimum pricing for alcohol, taxation. There's some advertising restrictions. There's some alcohol-free spaces, like parks and things like that. But the thing is, a lot of these kind of restrictions are actually being loosened over time. And there's no standard labeling unless the alcoholic beverage has sugar, and then you have to label it because of the sugar content. But otherwise, there's no standardization for serving size or calories or ingredients or any kind of warnings about anything. So, you can drink this as easily as you can drink some water. And apparently, the water actually has to have a label on it. I take that back. Here's my bottle of water. Oh, here's the calories. 0 calories in my water. But yeah, alcohol doesn't have to have that label. So you'd say, oh, well, you know, why do you need a label? Well, they actually had to go and study this, that there was cooperation from the territories. This is a few years ago now, about 5 years ago, where they put alcohol can cause cancer on some products, and they used a kind of case controlled, you know, white horse versus Yellowknife. And shockingly, or not shockingly, if people knew that alcohol causes cancer, they don't buy that as much. But the problem was, at least for this particular study, two things happened. One was that the unlabeled products went up by as much as the labeled products went down. So you didn't actually change overall consumption. That's fine. Like, that's just related to the labeling itself. The bigger problem was that after a month, the alcohol industry basically threatened to sue the government for defamation. And because it's a smallish government with a relatively small budget up in the Northwest Territories and Yellowknife, they basically caved. They're like, we cannot afford to litigate this, and they forced the study to close. So even after a month, they did manage to see that if people are warned about cancer, they will start to buy less alcohol. But of course, as an alcohol producer, you don't want that. So basically, they threaten the government with legislation, or sorry, with litigation, and shut down this study. But this study has been kind of quoted all around the world because it's one of the very few times that this has been trialed, because pretty much the alcohol industry will shut down anything and everything that threatens their product, because it's a $1.5 trillion a year industry. So just as a separate example, I don't have it in my talk on a slide or anything, but Ireland had passed legislation actually a few years ago, went through the government, fully through Parliament for everything, to label alcohol as a carcinogen. So Ireland has this. This is actually part of their government passed the law. It still hasn't been implemented because the industry is fighting it so hard. And just a few months ago, we got a notice, there's kind of a little alcohol group. We got a notice that Spirits Canada is an intervener in Irish legislation procedures. They want to kind of make sure that their voice gets heard. So if there's any doubt that the alcohol industry is trying to push hard, you know, to prevent people from knowing about how bad alcohol is, well, apparently the Canadian alcohol industry feels very strongly about Irish legislation. So there you go. Okay, so I'm going to kind of spin it over to the low risk drinking guidelines here and then get to questions. But, you know, when it comes to family medicine, I mean, you guys as like very, very front line, you know, I think there's lots of evidence and lots of kind of resources if you want to help people quit smoking, right? Like, this isn't news. You know, lots of people know they shouldn't be smoking. How can you help them quit smoking? There's guides, there's products, there's counseling, there's lots of stuff for smoking, right? But when you actually look for alcohol, it's actually really just about like raging alcoholics. Like, oh my God, you got to tone it down, man. You're like, you know, gonna be a raging alcoholic, and your alcohol abuse, and like that's all this kind of stuff you see. But for kind of, I'm going to say regular people, because I know that sounds bad, but I'm going to say for like kind of the standard consumer who doesn't have like a defined kind of, you know, addiction. There's not a lot of resources out there for just kind of regular people who want to have a few drinks, because it's just a normal part of society. Why would you need to have a resource to talk about that? So the old guidelines are now over 10 years old. So this is from 2011. So this is what we've all been using, you know, basically ever since I've been in practice. Well, I've been in practice for that long. So for guys, we're bigger, we can drink more. So it's 3 drinks a day or 15 drinks a week. And for women, it's 2 drinks a day or 10 drinks a week. The biology actually doesn't support that. The risks for guys are just as much as for women. I'll get to that in a second. So there really shouldn't be any difference between consumption of men and women. That's one thing. But like I said, in terms of the actual quantity of alcohol kind of permissible with these low risk guidelines, it's not safe. Like, it really isn't. And the evidence backs that up. So, you know, part of my analogy for this is if you think about driving on the 401, and I hear for this from my patients too, like, oh, you know, I don't drink very much during the week, so then I can drink more on the weekend, right? So I have my 5 beers on, you know, Friday night, Saturday night. So binge drinking is harder on the body, right? Because you're overloading those breakdown mechanisms in your liver. So acetaldehyde actually builds up more with heavy drinking on the weekend than it would if it was just a little bit every day, because your liver can deal with that better. But when you're driving on the 401, you know, oh, there's a lot of traffic. I'm going to slow down. I'm only going 50. Oh, the traffic eased up. I'm going to go 150. You know, and so that's how people behave, right? You guys see it every day if you drive on the highway. I see it every day. It's nuts. But that doesn't mean your average speed was 100. It's not the same thing. So people kind of interpreted these low risk guidelines kind of like that, like, oh, as long as I'm kind of averaging out, you know, within the guidelines, it's okay. But that's not what it was ever intended to be, right? It was intended to be like maximum limits. So that's where the new guidelines are coming up. So it's basically out this year. It was released just at the end of summer for kind of public review. That period has closed now. They were actually supposed to release it officially 10 days ago, but that got pushed back. So as I understand it now, the official release of these new guidelines is January 2023. Currently, there is no, how would I phrase it? Health Canada has not made it known that they will support these guidelines officially yet. So even though they supported the research and kind of funded the guidelines, they actually haven't said yet that they will endorse these guidelines, because it will be a major change for population to come to less drinking. Sorry, I'm skipping ahead. Okay, so this is just a few pages out of the technical stuff, and then I'll get to it, and then we'll wrap it up. But you don't have to go through the details of this, but pretty obviously red stuff is bad, you know, when you look at the graph. So this is for women. It just has a list of different kind of, I don't know, injuries or damage that alcohol can cause. Breast cancer is kind of second from the top. The more you drink, the more cancer you get, right? Liver cancer, you know, larynx cancer, you know, any of the cancers, colorectal cancer. The more you drink, the more cancer you get. Interestingly, though, for women, alcohol is actually found to be protective with respect to diabetes. And this one really, I couldn't explain this at all. For low-level consumption, it's protective for pancreatitis, but for higher levels, it's worse for pancreatitis. I didn't get into that. That's not my thing, so figure that out. But I mean, probably one of the big ones here, just right across the board, liver cirrhosis is worse, and it gets you up to very high risk the more you consume. This is in grams per day, so I'll get to in a second, but 1 drink a day is around about this third column. It's about 13 grams per day. So this is kind of 1 drink a day, and you're already kind of into the red for men and women. So this is now the men page. It's all kind of low risk to red very quickly. You know, road injuries, things like just, you know, trauma is on the list for guys quite quickly. No particular benefits for heart disease. Cancer risks goes up. Here's tuberculosis. There you go. There's a random one on the bottom there. But pretty much it gets bad the more you drink, and that's not particularly shocking information. So kind of when you average it all together, this is lifetime years lost on the y-axis, and this is consumption on the x-axis. So where you get kind of 1 drink a day, if you guys can see my cursor, it's around about here. It's where the dotted orange kind of crosses. So the solid line is kind of the averaged out men and women, you know, red and orange here. These are the 95% kind of confidence intervals. So by the time you're at 1 drink a day, risk is certainly high. And, you know, years life lost starts to become very measurably negative. So if you actually try and spin it, which people will still try and do, spin it that, hey, a little bit of alcohol is still good for me, you have to be down at the very, very lowest levels of consumption, which amounts to about 1/4 of a drink a day. like kind of low level consumption per day, because you're not allowed to binge drink it and average it out. It has to be a little bit per day. So basically you need to have like a shot glass of your wine, and then that might be okay. Probably it isn't, but it might be okay. But that goes to kind of what people actually think of in terms of consumption, that, you know, people don't recognize what a standard drink is. You know, is it a regular beer can? Is it a tall boy? You know, if I pour my glass of wine, where is it actually considered one serving? Most people actually don't know unless they've been trained. Like bartenders know how to do this. Most regular people don't. So when you actually think about serving size, and then, you know, people don't recognize it, and then let alone, you know, if you think about your different beers, like a lot of craft beers are not 5%, right? I mean, some of them get up to be 6, 7%. So same thing, it's not the same amount of alcohol that you're actually drinking, right? And you can't know, like you can't look at the can and know, unless you're willing to take the volume and the percentage and calculate it out, which, I mean, honestly, no regular person's going to do that. Very quickly about the heart. So the spin from the alcohol industry came from an older study. The biggest one was a Harvard study where they did find low levels of alcohol consumption could be protective for cardiovascular disease. That has never really been replicated. When they've tried to replicate it, they haven't, and generally it's been disproved. So the American Heart Association does not recommend drinking. It's actually generally a very negative outcome in terms of cardiovascular health. So atrial fibrillation, hypertension, all of those things, they all go up. Kind of a bottom line one. This was from the editor of the European Society of Cardiology journal. And it was just kind of a fun article. I just put it up. It's a funny read if anybody ever wants to look. But wine or chocolate or coffee, you know, which of these things that we claim are good for us are actually good for us? So wine is not. At best, it's neutral. Most likely, it's negative. Chocolate is good for you, but if it's dark chocolate and only in small amounts. And coffee is actually good for you as long as you're having less than 4 cups a day. So, you know, from a cardiovascular point of view, alcohol is not a winner. Okay, so you can't think it is just because industry says it is. So these are the new guidelines. They will come out with nicer looking stuff than this. This is just from the technical guidelines. But this is kind of the new guidance. And it should be official as of January 2023. So this would be the type of thing where presumably you guys will get like posters or something to put in your office, or handouts or something. I don't know. I hope there's some kind of actual push for this. But I think the biggest difference is this is now kind of per week instead of per day. Okay, so before, if you were allowed 15 drinks a week or 10 drinks a week, now it's like 1 or 2 drinks a week, right? After that, risk starts to go up. And this is same thing. This is population level risk. This is not necessarily individual risk, but the more you drink, the more bad stuff happens. There's very little doubt in the evidence when it comes to that. And anybody who tries to spin it otherwise, I would have very serious doubts as to what kind of logic they're using. Because the evidence is really irrefutable, honestly. So bottom line, for most people, it's 2 drinks or less per week. It really shouldn't be more than 1 or 2 drinks per drinking occasion. Just as a side note for guys, if you start to go above 2 drinks per drinking occasion, the risk of violence goes much, much higher very quickly. So domestic violence, trauma, drinking and driving, those types of things. But the more you drink, the more bad stuff happens, right? So I'm an oncologist. I see more cancer. I see younger people with cancer. Hey, doc, how did I get my breast cancer? I don't have any cancer in my family. But, oh, you drink 14 drinks a week. Oh, I thought I was supposed to drink every day because the wine was supposed to be good for my heart. No, probably not. And it's quite possible that that alcohol actually gave you your breast cancer. Right? I mean, I actually have that conversation maybe every other week. So here's kind of the bottom line. This is my last slide. So basically, every level of alcohol consumption has risk. I don't drink. I've only ever had kind of minimal amounts of alcohol just to kind of try it. I don't particularly like the flavor, I've got to say. But anyways, as a non-drinker, my risk of death from alcohol is not zero, right? Because I could get attacked by some drunk guy or killed by a drunk driver. So my risk of alcohol death is not zero, but everybody's risk goes up the more they're exposed to alcohol, including children, by the way, right? Because kids get killed by drunk drivers and domestic violence. Basically, if you're at kind of 1 to 2 drinks per week, the risk is realistically very, very low. Your body can tolerate that amount of a carcinogen and deal with it. After you go higher, the risks go up for everything, except for diabetes in women, apparently. So what else? More injuries are related to men drinking. Don't drink when pregnant. Don't breastfeed when pregnant. And even though guys have more kind of violence outcomes with respect to alcohol, in terms of medical negative effects, it is worse for women. So yeah, the more they drink, the more bad stuff happens in their systems. Partially, that's that estrogen effect. And that's kind of the end of my talk. So, you know, just as a kind of wrap it up, you know, if this was, I don't know, 100 years ago, we'd all have our cigarettes out and we'd be telling our patients, hey man, don't smoke. Smoke is bad for you. But everybody's out there smoking, including the celebrities. And here we are now. People know not to smoke for the most part, but everybody's drinking and everybody's favorite celebrities are out there shilling their wares. So times don't change that much, right? Okay, I think that's it. I'll leave it at my questions slide, but thank you very much for your attention. And I think maybe what I'll do is actually exit my slide so I can actually see the Teams meeting.
That was great. Thanks so much, Dr.
Okay.
Paul. I appreciate that so much. It was a fantastic talk. We were you know, some of it's bad news for those of us that do consume alcohol, but it's important for us to have the information. And thank you very much for taking the time. I know we have a question already from Dr. Mehta, so I'll pass it over to him.
Yeah.
Thanks, Shannon. Thanks, Dr. Paul. Great talk. I really enjoyed it. Learned a lot and lots to think about. So I want to make one comment and then ask you one question. The comment is on the study, the Harvard study on CBD and alcohol. You know, anecdotally, I found that study got a tremendous amount of press, and I still to this day get patients quoting that study back to me. And I agree with you. I mean, obviously, the subsequent studies did not bear that out, but that got very little press, and for whatever reason. But my question to you is, the point you made about young people who binge drink and the effect, you know, the increased mutagenesis with that. Is that data similar to marijuana, that the younger the use, the more the damage, or has that not been studied or not been shown yet?
So I'll go with your first point first. So the alcohol industry spent a tremendous amount of money promoting that study, right? So it got everywhere very quickly. But then when there's further studies, oh, nobody pays attention to that, right? So, I mean, that's how it is. It's money, right? With regards to marijuana, I actually admit I'm not super aware of the marijuana data that's out there, but I think from a younger patient or younger consumer, a lot of the evidence for alcohol is about neurologic effects rather than like carcinogenic effects. So the one that I actually was kind of getting at, it was actually an animal model. So, you know, it's more kind of theoretic that, you know, you have mutagenesis with younger patients. And yeah, so, I mean, I'm extrapolating that into humans, but biologically it makes sense. But yeah, is there any way to prove it? No, there's no way to prove that.
Thank you.
Okay, just since there's a little bit of dead air, I'm going to throw it out there that currently there is a bill going through Senate, and there is another one going next spring through Parliament to introduce labeling, like standardized labeling onto alcohol products. So that may end up changing. And I think that that all goes along with kind of these new guidelines in 2023, leading to some labeling, which will lead to education. And then we can kind of, build off of that to kind of encourage, safer consumption habits. So it's not going to fall like specifically onto us, I hope. Like, I mean, honestly, more so onto you than me, because by the time they get to me, they've already got big problems. But it should really be, ideally, Health Canada will endorse these guidelines. They'll actually put out some commercials or radio ads or print ads, or, like it should actually become common knowledge. I'm hoping.
I just wanted to say thanks so much. My name's Britt. We're actually sitting at the RAM clinic in Peterborough, and we're very happy to talk to any family doctors about medications that can help, because actually the medications that we have for alcohol use disorder, they actually are sometimes a bit more effective in people who have not so significant alcohol use disorder. And so there are a lot of treatment options that can be prescribed in primary care. So if people need support prescribing those, or if patients want to come see us, we're happy to do that, obviously. And I think people are probably familiar with the RAM clinics, and I was kind of in and out for the talk. I apologize, but there's one in Lakeridge. We have an OTN one in Coburg and Halliburton and Lindsay, and we have a walk-in one in Peterborough.
I think you have one in Scarborough too, correct?
And Scarborough, yep. And like women's college, like in the GTA, there's lots also.
Really appreciate the talk, Dr. Iqbal. I think, I'll tell you, in primary care, this is getting a lot of discussion at a lot of different, tables, a lot of other CME events, which are unrelated. I think we're going to have some really interesting conversations with patients because, to be fair, the advice we've been giving for years is changing. Oh, sorry, that's one other thing you mentioned, which I wouldn't mind getting your feedback on. You said the guidelines have always differentiated the drinking guidelines for men and women, and then you said, but that doesn't make sense. Can you explain where you were going with that, and why does it? To me, it makes more sense to have more weight-based guidelines possibly than that. But you also did show that slide, which showed that the damage for heavy alcohol intake was much more for women than men. So if you just expand on that.
Yeah, so there was a little bit of a story behind that. I'll take a couple minutes. So basically, down in the States, when the Surgeon General kind of officially classified alcohol as a carcinogen, the American Consumer Protection Agency started to get involved. There's like a national thing down there. And there was a national scientific advisory panel to the president or somebody, I don't know, National Scientific Advisory Panel. And so they basically reviewed all the data that's out there about, consumption and how much and quantities and men versus women. And no distinction was found between men versus women in terms of risk, like overall risks. So for individual risks, like it is different in terms of liver capacity and things like that. But overall risks in terms of morbidity and mortality, there was no difference. So they tried to actually have in their new guidelines in 2020 that men and women would have the same recommendation for consumption. And that got overruled. By the time it actually made it to publication, it was still 2 for men, 1 for women, despite the science saying otherwise. So read between the lines as to how that changed. But yeah, the evidence doesn't back it up. Like I think you guys probably are the same vintage as me for the most part. Like there was a whole thing when you were a resident, the guys could have 2 drinks and be on call. The women could only have 1 drink and still be on call. And it was just like, okay, I guess it makes sense. The guys are bigger than the girls. But yeah, it never actually backs up in terms of like long-term damage that's done, because it's just damaging your DNA kind of all the way through you.
Thanks again. Great talk, and really, really, really appreciate it.
You're very welcome. And I think that's time.
Fantastic. Thanks so much. This will be recorded, and we will send out certificates of participation to everybody who's joined us today. So if you want to share the link with your colleagues, you'll be able to do that as well. We'll make sure that's available. Thanks so much, everybody. Have a great afternoon.